in a minute. So these ones, the 13.0 and the 8.0 are for body. You actually fired, in theory, 25, exactly 25 shots. More nerval damage here, this nerve here that goes up 0%. You can actually set it up down to minus 50.
Fine.
Beautiful. Can make it higher.
No.
No. Then, therefore, this is why we can only treat the cheek area, the cheeks. Then you just slide it out by 25 millimeters, and you can actually see the here. Have an idea what's in it. Yes, it's actually a if it's a golden service, then for a year, even if the device breaks down, we'll just send a brand new one.
So why does
And
it
then
only
just with
have 1 month guarantee?
Yes, because it's a special price.
Oh, okay.
It's a special price.
Okay.
That's why. If you want, we can sell you more expensive. You get the full year. There's no problem. We
It's
can
like,
do that.
no, I just have to ask.
Yes, of course, you have to ask. Okay, now we're gonna put this one is not needed. I'm gonna leave it here.
No, it's got a. You see, it's got a gap there. So where's
Yes.
that one's?
We
That's the.
what I normally do is trial and error.
Oh.
I'll go there,
Uh-huh.
and then that's it, I think. Yeah. See whether it does work. Yes, it does work. And then what you see on the screen is this. Get our logo and vaginal. Then you go back and face.
Oh, the light is on
Okay.
the screen here.
Gonna go back because there's no any head in there. And what we're gonna do. So this one is empty. This one is empty, okay? So this is the transducer in here. Can you see it?
With the little line. Yeah.
Can you see the transducer? Yes. And it goes up and down. And the line here is, can you see it? We've got 0 to 25. So 25 millimeters, from 0 to 25 millimeters. And it starts shooting up until here, and you can tell the device by changing the parameters on the screen to actually deliver dots from here to here, from here to here, from here to there, to the top, if you wish. And then we can actually adjust that length on the device. So now what we're going to do is just going to fill this with water. We're going to do it here, see whether I can actually show it. So it's going to be, and I need a bit of what do you call it?
Paper towel.
A paper.
Paper towel.
Yeah. So
you
fill
fill it level.
Completely, yes.
Okay.
You get a paper. Okay, beautiful. There we
So
are.
I need to order those stickers from you.
Yes. We're going to leave you with some. Can you see the number?
Is that in
3.0
millimeter?
millimeter. 3.0, okay? 3.0. So you can see the number there. What 3.0 means, is that the shots are delivered exactly 3 millimeters from the surface of the cartridge. Okay, that's very, very simple.
Is that also filled with water?
Yes,
This is a
I just
sticker.
filled it. I just filled it before I came here. This is, what does it say?
1.5.
1.5. What that means is that the shots are delivered 1.5 millimeters from the surface of this cartridge. And if you see here, from here to there, there's what is it? The distance. So look, the distance between here to there.
Oh, this
Here
is
to there is
width,
25
the
millimeters
width of the line.
of the line. Yes, this is 25 millimeter. This is 15 millimeter.
Is it?
So 1.5 centimeters,
Okay.
and this is 2.5 centimeters. Okay. Gonna open the other ones one by one. They're all being pre-filled with water 2 days ago. So what does this say here? Show you. 13.0. What that means is that the shots are delivered 1.3 centimeters away from the cartridge. So they're quite deep. Yes, this is for body. I can open the other one. So this one says 4.5, which is
Also,
the shots are delivered 4.5 millimeters away from the cartridge. Okay,
is that one for face or
that's
body?
for face.
Face.
I'm
So
gonna
all
open
these ones are for face.
I'll show you which ones are for face, and we're going to do
That one
the
is
test on
body.
the device. And this one, what does it say? 8.0. So look, should we show you? Yeah, perfect. 8.0, which means that the shots are delivered 8 millimeters away from the cartridge. Now, the ones that are for body are,
How do you know
These
what
two.
is this width? It's not written here.
yeah, it's not written, but you know because they're all the same, and I'll explain in a minute. So these ones, the 13.0 and the 8.0 are for body. Okay. Then the 1.5, which is this one, the 3.0 and the 4.5 are for the face.
So how do you decide
then-
which one goes where?
Which one goes where, meaning?
Is it a specific area on the face that you work with?
Okay,
each
beautiful.
hair?
This is,
Does it go according to?
we're gonna go into the face here. So the face, what it does actually, this image here. So we've got two images, the vaginal and the face. Okay, the face does the body and face. We're gonna click there, and look at what we do. See, this cartridge is 1.5, and it's got 1.5 centimeter from there to there. All the others I've got from here to there, I've got 2.5 centimeters, which is 25 millimeters. Okay, so now as this is an exercise, we're just gonna place this one in. Okay, and it stops buggering us. Okay, excuse my language.
No, sorry that I'm laughing at the buggering. I'm thinking of Nora. Where's Nora and Sandy?
So they're gonna watch this anyway.
Okay,
He's gonna
so
watch this.
it
Okay.
actually shows you.
Yes, it shows you
where which
1.5.
cartridge
And
is.
also, if we actually zoom in here, look, it shows you also on the face where you can actually
Work
place
with
the shot.
1.5.
Yeah. So basically, if we look at this, so we've got the forehead here,
close.
and here as well, the under eyes, and then this part of the face, the cheeks, and the mouth. The mouth is going to be quite sensitive. And also you cannot see you can do the neck. Now please look at me. Please look at me here. Now, basically here with a 1.5, you can do the whole face. But the area to avoid is this one. You see the cheekbone here. It's just because it's going to be painful. And if you can, please do avoid the Adam apple. The 1.5 is quite safe. Let's go back to this. Let's go back to this now. Basically, it's the safest one, but I suggest you start with a 4.5 when you do the face treatment. So now I'm gonna go and replace the cartridge for a 3.0. There we are, have it. Okay, this is a 3.0, and if you see here, from here to here, there's 25 millimeters. Okay.
So that's the length.
Yeah, and look at the length there. This is the length, 25 millimeters, and then you can actually change that if you want. You can reduce it down to 5 millimeters, and this got its own merit. This has got its own merit, and I'll show you.
When will you reduce it?
I'll show you when we're actually doing the treatment, and we're leaving it at 25 millimeters. So that means that if we're actually looking at the cartridge again, from here, basically the shots start from here up to 25. If I actually reduce the length here, say for example to 20, here, we're gonna go look here. Basically the shots are gonna start from here up to 20 millimeters. They're not gonna go all the way to here. So this is a demarcation so that you know where the line starts and finishes when you're actually delivering the shots. But at the moment we're leaving at 25 millimeters. Now let's look at this here. What we see is what cartridge we've actually inserted. Every time we actually change the cartridge, we see which one is inserted. Here is the total that the cartridge has, and this is what is remaining in terms of residual shots. This is when the line. This is the how many lines we have actually fired with this cartridge. This is the total of the treatment. And this thing, what we're gonna do, I'm gonna do this. I'm gonna press on this. When I press on this, what you've got here is a parameter called distance. This is the distance between the shots being fired, and then you can change it between the minimum, which is this one, and a maximum, which is 1.6 millimeters. So in this case, every 1.6 millimeters, you've got a shot being fired. So if we go back to here, so the first shot is fired here, boom, and then it moves 1.6 millimeters and it fires another shot, and so on up until the end, because we actually have selected 25 millimeters. Okay, so if you do 25 millimeters divided by 1.6 millimeters, you know the number of shots have been fired by the cartridge. Okay, so I'm going to set this back. Yes,
Each shot
it
yeah. Counts off here.
Yes, this is the this is the residual shots there. These are the residual. This is the total shots of this cartridge. So the residual is 9,550, and this is the total that this cartridge had, because this cartridge has been used a little bit. And then here we've got this parameter here. Okay, so what I'll do again, I'm just gonna long press here. I'm gonna go into the setting. Now this is the advanced setting. If we actually get now a bit, okay, beautiful. Yeah. Basically what you see here is a 1.5 cartridge is being set at a threshold of plus 50, and
What is the plus 50 standing for?
Okay, we can actually leave it at plus 50 here. The plus 50 means, so let's put it as 0, actually 0%. 0%. You can actually set it down to minus 50 plus to 50%, up to 50 plus 50%. Let's leave it as 0% for it. Okay, this is the normal power threshold. This is the normal power level. What it means is that when you go back, let's go back here. Let's go back. Return, and look at the power level there. Look at this power level here. Okay, the power level is saying 0.1 joules. So that means is that it's not exact science, this 0.1 joules. is a certain parameter that the device gives you, and the maximum is what? 75. Yes, there's no exact. What that does, what that setting that we've seen before does. Yes, you're gonna long press here. Go back here. What this does is, if I go and put 50% plus here, and I press the return, here, when I've got 0.1 joule, this time I've got 50% power more than I had before.
Oh.
So in theory, this you don't actually need to know, but I explain everything. These are all the secrets about this device. And so basically, if I go to the maximum, now this maximum is 50% more than it used to be. So I prefer it that way. So you can actually use a very, very high power if you wish. But normally if you use it this way, even low powers are quite strong. Okay, now we're going to go and change to... the other thing is, look here. This is the 3.0. And the 3.0 you can actually use on the forehead, temples, and the eyes, and the cheeks, but not on the mouth. And also you can use it on the neck, which we're going to show you how to do it, okay? Now we're going to use we're going to change it for the 4.5. Here, I've got the 3.0 there. So just... So 4.5. Now, what do we see at 4.5? Where can we deliver the shots?
Lower portion.
That's it, only on the cheeks. So if you say, for example, have a look at Kathy. Yeah. Can you turn your... okay. Basically, we can actually treat Kathy all the way here, and I'll show you how we're going to demarcate the area of Kathy's face in a second. So, but we cannot treat her face anywhere else, not even on the neck. Not even on the neck. Better not, because we're actually going a bit too deep. Now as a rule of thumb, okay, let's have a look at Kathy's face from a distance. We'll take the glasses off Kathy, please. Yes. Now, with the 1.5, pretty much we can use it on the whole face, pretty much, other than the upper eyelids. Never use it on the upper eyelids. And also, if we can go up there, okay, not here, the Adam apple, forget that, not this area in the middle, okay, not the Adam apple. Let's relax. The 3.0, we can use it pretty much on the whole face, other than this area here, this area there, and in the cheekbone in this way. You can actually, you can apply the cartridge, for example, this way, or this way, but never directly on the cheekbone, not because of anything. It's just going to be too painful for nothing, because we're actually going to hit the bone. And then as we do the treatment, you'll actually...
you go like half on top and half underneath.
As long as it's not going to go you see that if you touch here, we've got the cheekbone, and if you place the cartridge directly on the cheekbone, this in 45 degrees, you're going to hit the cheekbone, and it's just going to be painful. We're not going to do anything. But if you put it this way, it is okay, or that way, it is okay too. So either this way or this way. This way or this way, but not 45 degrees directly on the cheekbone. So never on this area. And we're going to do the drawings of the face quite shortly. And never here in the middle in this area. We're going to draw it as well.
But you can do it like here.
Yes, I mean here or there. You can place the cartridge in this position if you wish, or this. But only the 3.0, not the 4.5.
And when you move it, how far do you actually space it when you move it per shot?
1 millimeter. So, for example, we're gonna put a shot there. We're gonna fire, finish the fire, and then we're gonna move 1 millimeter. finish the fire, 1 millimeter. Fire, 1 millimeter. Fire, 1 millimeter. Fire, 1 millimeter, and so on. And then the other way around. Fire, 1 millimeter. Fire, 1 millimeter. Move it slightly. Fire, move it slightly, down, down, down. And then the technique is to get a pen. Draw squares on the face. So because this is 25 millimeters, yes? And we've got 25 millimeters as well. So we're gonna draw squares on the face and the body, exactly 25 millimeters for the 3.0 cartridge and the 4.5 cartridge and all the other cartridges other than the 1.5, because the 1.5 has got, if you remember, 1.4 got 14 millimeters. So in theory for the 1.5 cartridge you've got to draw 14 millimeter squares, but for all the other cartridges you've got to draw 25 millimeter squares. 25. And the way you fire is, first you actually, for each square, in theory what you should do, you fire this way, in this direction, up to there, and then you fire 1 millimeter apart, in this direction, 1 millimeter. So the spacing between here and there is 1 millimeter, and the spacing between there is 1 millimeter, 1 millimeter, 1 millimeter, and so on, up until you actually fired, in theory, 25, exactly 25 shots, in theory. It doesn't really matter. If you've done it this way, in theory you're finished with this treatment of this. But many people do, say for example, 10 lines there and then 10 lines in this direction for a total of 20. If you can do the count for a total of 20. But if you do it exactly accurately, what you should do is fire a shot, slide 1 millimeter, fire another shot, so you're actually making, in theory, 25 shots per square. But many people, what they do, they fire 10 shots this way, maybe spaced at 2 to 3 millimeter apart, and then another 10 or a bit more in this direction.
But which will be the most effective? Would you rather just do? I'd say
in order to have the best spreading of the shots, do it 10 and 10 or 10 and 13. So that's the best spreading of the shots. But it is important that you just actually deliver this ablative spots as evenly as possible on the skin. And then the more you deliver, the better. The more you deliver, the better.
If you say shots, when it counts down, does it count down per dot that it shows or per line on the cartridge?
Per line. And then remember, if you remember in this here we've got this parameter is 1.2 at the moment. I'm going to change it to 1 millimeter, which is the lowest, and the maximum is 1.6. So 1.6 means, here, if we go here again, so we've got the line, they've got the line here, 25 millimeter line. It just fire a shot, just displace itself by 1.6 millimeter, and then displace again 1.6 millimeters, and fire another shot of every 1.6 millimeter, and so on. Whereas if I put there 1 millimeter, it just does this, bum, one shot, 1 millimeter, displaces 1 millimeter and fires another shot, displaces another 1 millimeter, fire another shot. So the shots per line increases as you decrease that parameter.
So will it not be more
it's better
efficient
to have, yes, it's
to
better
have
to have
it closer?
Yes, it's 1 millimeter. But it's also, it's got a very nice visual effect because do we have gel?
Yes.
Yeah. This is just an experiment that you don't even need to run. It's just to show the power of this. This is of the device. This is a piece of Perspex. Okay, so quite hard plastic, and we're gonna go and dent it. So we're gonna get this. So what we're gonna do is just gonna go there. So this is the 4.5. You can actually watch the screen. Gonna long press there and make sure that everything is plus 50, plus 50, plus 50. Get the maximum power. Then I'm gonna go maximum power there. It's 1.2. And then what I'm gonna be doing, I'm gonna leave it at 25 millimeters. I'm gonna change the setting here at 1.6 to actually show you the shots in the best possible way. And I'm gonna take this, going to take this, and once I place the gel on top, I'm gonna fire the shots on this Perspex, and I'm gonna show you how the shots are delivered. Not on the side that was the closest side of side that was touching the cartridge, but on the opposite side, the side where is actually further away from the cartridge. So this is what actually happens in your skin when you use this cartridge here. We're going to show you in a second. And the same, you can do the same experiment with a 1.5 and the 3.0, but you've got to change this one, because this one is 4.5. So Kathy, do you need help? Yeah.
When
Mm-hmm.
you work on the skin, do you also leave it at 1.2 joules, or do you decrease?
I'm only using it at the maximum power level because we're going to try and do this Perspex test at the moment. But when we do the treatment, what you have to do is just work at the minimum power setting first. You start at the minimum, see how she feels. If it's okay, then you increase up to what she can bear. Okay, remember, I mean, what doctors have done for many years, and they still do sometimes, they just go at a certain level and put anesthetics on the face and the stomach. So now what we're going to do, we're just going to go and do the test on the Perspex. Can you see clearly there, yeah? Gonna put the gel. This gel looks quite good. Yeah. So I'm gonna place this way. I'm gonna press ready. See whether it works. Top powder. And you see the dots, they are, you can even smell it. So this is what happens in your skin. If you touch this, is actually the dents are outside.
My word.
So this is what happens on your skin. If this were your skin,
Oops.
yes, no problem. And then if you touch here, nothing has happened. Here on this side that was actually touching the cartridge, nothing has happened. So the damage
It's totally
Inside.
internal.
is completely internally. This is why it's got no downtime. Gonna do it again, and that's beautiful, isn't it? So this is just an experiment
Okay.
to show you the power.
This is now on 1.
Yes,
Point
is the top power level. So if you imagine this on your skin, is really. This is why if
And
you're
that's
using
on-
it at top power level,
on the one, what you said,
Look.
the 1.6 width in between. 1.6
yes. I'll show you what
millimeter
happens if we change the
space.
spacing. Okay, gonna do the minimum. Okay, 1 millimeter. Okay, let's go and look at it now. Gonna change it a bit.
Much more effective.
Yes, it's actually almost a straight line, whereas you can see the dots here, and you can smell it.
I just wanted to say that.
And you can smell it. So imagine what you get in your skin. So that's just and then we can repeat this test with the 3.0 and the 1.5 cartridge. Okay, but we're not going to do it. It's just the same thing. And I think we can actually start and doing the treatments if there's not any other questions. And if we even want, we can actually do the exact same test using the vaginal thing, the vaginal head. So it does, on the vaginal head, it does the same thing. Okay. Any questions?
I am totally intrigued.
Okay. So that's one, and then where do we put this thing? Just do that. Yeah. Now let's talk about the vaginal.
Okay,
Yeah.
I wanted to know what's the you said the difference between this one and that one is also the depth of delivering of the
Yes, so let's go back into the
treatment.
vaginal here. So if we can see where the okay. You see this is actually say 3.0. The cartridges that is we are actually placing in there is 3.0. 3.0. Yes. So the software recognizes the type of cartridge you've got. Remember, you put an auto in there, and the way you actually use this this device is by you place that gel in there, you slide the condom in, you insert it in the vaginal canal up until you feel resistance, so you cannot actually go any further. And then once you cannot go any further, you see here whatever number you've got, and then you slide it out by 25 mil. So say for example, up until here, so you actually slide it into the vaginal canal. For example, it's just for example, you see this is the number you see, and you cannot actually go any further in. What you do, you have to slide it out by 25 millimeters, roughly this way, and then you can actually start firing the shots.
So those measurements there is in millimeter.
It is in millimeters, yes. Okay, then you can start firing the shots. How do you fire the shots? If we have a look at the screen, here we've got 350, which is the degree rotation, the total degree rotation, which is 350 degrees. This is the displacement between each shot. So every 5 degrees is actually going to deliver a line here, a line of 25 millimeters. This is the length of the 25 millimeters, so you can actually even tell it to deliver less than 25 millimeters if you wish. The pitch is the distance between the shots. Do you remember before it was actually, and again the minimum is 1 and the maximum it should be 1.6, or actually more. In this case is more. It's 5 millimeters, very, very far apart. And the power level, you normally adjust it to start it with the minimum power level, and then adjust it up as the customer can actually bear it. And then, say for example, if I change this and I decrease the angle, look at the number of shots, the total increases. Just gonna, there's 117 and so on. But I'm gonna put it back to 5 or 6, 5. And what we're gonna do is just gonna set it that way. So what we're gonna do is we're gonna press ready, and then look at what happens. It's actually setting up on its own. It's rotating on its own. And it stops. Okay. Then what you do, you press start. Press start. And here, and then you've got it in auto. Make sure you've got an auto if you wish, because it's much easier. Make it auto, is auto. And then let's have a look from a distance. So like this from a distance here. And then I press, delivering a shot, and it delivers a shot and rotates. It's all automatic. So once it's in the vaginal canal, it does its job. Keeps rotating up until, so you don't have to do anything. You just wait there up until it's finished, I'm going to stop it here. And if you see there on the screen, yes, see there on the screen, we actually reached 30 degrees. And if I keep pressing, I press on this button again here, I carry on up until 350 degrees, up until the 0 point. And then up until actually 350, and then it gets to 0. At 0, it doesn't fire again because it's already fired. Okay, but you can actually even change that and have it to fire again at 0 by changing this to 360. You don't want to do this, that's enough. So that's quite simple. What you do, once you've done the complete rotation, the 360 degree rotation, then you slide it out by exactly 25 millimeters, and then you do it again, the rotation again, up until you're completely out. It's very easy. So you start with the 4.5 first. Once you've done the 4.5, then you change it for the 3.0, and you've done the job. Very, very easy. Okay, any questions?
No.
So basically it's very, I'll just recap again. Once you put the, these should be sterilized, but once you put it on, you put your gel on this black bit of the cartridge, put the gel on, you slide the condom on, and then you insert it in the vaginal canal. Once you encounter resistance, then you just slide it out by 25 millimeters, and you can actually see here, have an idea what 25 millimeters is. And then once you set it up, you can start, you press this button, and it does its job. Once you've done the complete rotation, you just slide it out again by 25 millimeters in order to cover the whole of the vaginal canal. And the power level, you adjust it by making sure that the customer is still okay with the treatment. So
I wouldn't recommend. What is the medical recommendation?
I say wait a week.
Give it a week.
Wait a week. I don't think, to be fair, they can go immediately. Maybe because it's gonna feel a bit different, but because the damage is done in the internal walls.
Right.
If it were a treatment using CO2 lasers, which is quite a CO2 laser treatment or a laser treatment for vaginal rejuvenation, then it'd be different. Then you really need to wait. But with this sort of treatment, you can actually, even if they do immediately, it's fine. But wait a week.
All right. Now the other thing that goes through my mind
yes,
is the dreadful period. You don't do this when it's that time of the month. How long before, after?
Soon after the period is best.
As soon as the period has passed.
Yes, it's best. Yes.
Okay. Some of us don't have that problem, but some do.
Yes.
And
Don't
how
get too close.
far
Don't get
apart?
too close. Don't get too close to the beginning of the period if possible.
Okay.
How far apart is 3 months apart?
And that's also for body and face.
Yes. Yeah, body and face and vaginal. Yes. But the thing is, they used to say once a year because it used to be a very expensive treatment, £1,000 per face treatment with this device. So they used to say one a year or one every 2 years. They used to say. So.
But if you've got somebody that's got a lot of damage and they want to try and do quite a bit of repair, once every 3 months until they're happy with the result.
Yes, indeed.
Okay.
Indeed.
How long does it take before you see a result?
6 months. Well, it starts from 3 months and then it progresses over the period of another 3 months. So you should see results coming in 3 months. It's very different to plasma. Plasma is more, what do you call it?
More immediate.
Yes, more immediate, yes. Because it's more superficial and inject heat into the skin. Here what we're doing is actually making an injury inside the skin without even getting any heat inside it. So
But
this
if
is
one
why
thinks
this way.
about it logically, it takes 28 days for the skin to rejuvenate and shed. You've got at least how many layers internally that have to work and tighten and what have you until. And then again, of course, if you have surgery, they always say to you, it appears to have healed, but your healing is only completed 3 months.
But then, and when you actually get the treatment done properly, what you'll feel is just a tingling feeling on your face that lasts 3 days, and then if you had a very harsh treatment, they can get also bruising. But at least for 2 to 3 days, you'll feel it.
The tingling.
So customers know that you've done something effective.
But you won't see any tightening yet.
Not immediately, because the injury is from as we've seen in the cartridge, is actually internal. So, okay, and I think we're pretty much there. Any other question? Don't need to be that careful. Now, there's a nerve here. I can't remember exactly what it's called, but it's in the manual. It's there. Actually runs this way, goes this way, and then up. Although we're not going to really care about how we're going to shoot this area, this area here is quite important because there's been reports of nerval damage here, this nerve here that goes up. And then if you've got the nerval damage, then you're going to get not face paralysis, which is permanent, but is going to be temporary, because everything is going to, we're not going to be able to truncate the nerve using this treatment. So we're going to make X's here. So this area mustn't be treated. So I'm going to make a line there. So this area mustn't be treated. And I'm going to do the same here. I'm going to make X's there. So this is a no-go zone. And then I'm going to make a straight line there. So the no-go zone is then the catheter, if we go there. Then the other no-go zone is here. There's a no-go zone. Actually, let's make it that way. You can actually feel it. Here you can actually go there. So here you can actually do the treatment, not with the 4.5, with the 3.0 you can actually do the treatment. So here the neck, you can do the treatment with the 1.5 and the 3.0, not with the 4.5. But we're going to do the marking for the neck as well. So here pretty much with the 3.0 you can actually treat the whole neck here, or here, you can actually treat it, no problem. Now, we're going to show you how we do the marking for the 4.5. It's very, very simple. So the 4.5, we're going to use the 3.0 because the 4.5 isn't in there. So what you do here, because we've got this distance here is 25 mil, so you're going to place a mark there, roughly. Just going to make another mark in there, roughly. I'm not the best at drawing. Then you make another line there that actually joins up, and then you make another line here, because you see, actually, boom. Make another line there which is 25 millimeters, and another one there which is 25 millimeters, and then you join it pretty much as straight as possible. In theory this is 25 in theory, okay, my lines are not best. And here, this is when we're actually going to be a bit smart, and we're going to change, we're going to adjust. If we actually go into the screen here, you see when we're actually treating this area here, which is not 25 millimeters, maybe it's, in this case it's 5 millimeters, then here we're going to adjust the length to 5 millimeters. This is approximately 5 millimeters. So here, what we're going to do, we're going to use the full length. We're going to fire the shot, bum, 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 bum. The shot, ideally, what we want to do is just fire a shot, displace it by 1 millimeter, fire another shot, displace it by 1 millimeter, fire another shot, 1 millimeter, fire another shot, 1 millimeter, and so on. And so on up until the end. Here, the same. One shot, 1 millimeter, one shot, displaced by 1 millimeter, another shot, displaced by 1 millimeter, and so on, always perpendicular to the skin. And this is with a 4.5. And the other thing is,
it horizontal.
yes, you can.
Fire, yeah.
Just a second. And then here, when we're here, you actually adjust the length. Just going back to the screen. adjust the length to 5 because it's approximately here. It's approximately 5, and then you place the cartridge this way, and you start firing the shots. Boom, boom, boom. Again, you fire the shot, you just place it down by 1 millimeter, fire another shot, 1 millimeter, another shot, 1 millimeter, another shot, 1 millimeter, and so on. And now, basically, you've got to, here I can actually, then you go and feel the cheekbone. When you feel the cheekbone, you can draw another line on this cheekbone. It's not actually a good line. The cheekbone is there. Actually touch it, that's the cheekbone. So basically you treat up until here and make sure there's always perpendicular. When you actually treat, when you do the treatment, when you're firing the shot, make sure it's perpendicular to the skin. Don't actually make it directly onto the cheekbone at 45 degrees, because that's gonna be a bit painful. And then here you actually, sorry, the cheekbone is there. This is the mandibular bone. Many apologies. Then you touch the cheekbone there, and you make it, because I can actually feel it there. And make another line there. Here you can actually find the other bony area, and you make another line. So with a 4.5, you treat it from here to there, and then if you want to be more precise as well, what you can do, you can make another line there. This is a square, and this is approximately, look, this is approximately 25 millimeters, so you've got 2 squares. Make another line there. It's approximately 25 millimeters, so you've got 1, 2, 3, 4 squares. So what you can do here is, if you want, do 10 shots here, boom, then you displace yourself, boom, 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 up until here, and then another 10 shots in the other direction to cover the square. So you've got 20 to 25 lines in here, and then 20 to 25 lines in here, again here. What you do, just fire, displace a little bit by 2 millimeters approximately, and then once you've done that, you fire 10 shots, then you go the other way. So you actually deliver 20 to 25 shots or lines per square. So you've got 20, 40, 40 and 20, 60 and 80, between 80 and 100 lines per in this cheek with a 4.5. In this case, I'm just holding this because the 4.5 is in the device, and then you just repeat the process on the other side. Okay.
What about here?
And then here, with the 4.5, you don't actually treat this area because it's far too deep. With the 3.0, what you do, you can actually do the same thing if you want. If you really want to be precise, with the 3.0, you just do the same marking, and then you do this, and then here you do the same marking. So we've got the square there.
So you don't go over the carotid vein.
Carotid vein is, where is it?
That one.
Can feel it.
Now.
Kathy, are you alive?
My what?
Are you alive? What
Oh,
is
yeah.
it? She's not alive. Kathy,
Oh, you
Are
guys
you-
are lucky, aren't you?
are you alive? She's not alive. She's not alive. No, the point is, even with the 4.5, it's not going to go to the carotid artery. But don't do it with the 4.5. 3.0 is superficial enough not to cause any damage. So, yeah, where is it? If I were a vampire, I couldn't even
Score.
So, exactly. So you can do the same thing here, and again it's the same process of making the lines and making the squares, and approximately do the 2.5 25 millimeter squares, and so on. Say for example, if you want to do
Closer to the nose and closer to the eye.
yes, that's right. So in that case, if we're actually looking at Kathy again, because I'm going to use the 4.5 for marking here, what we're going to do is just avoid this area in the middle. It's not as if anything is going to happen, nothing is going to happen here. And you can do the same thing, the same type of marking if you wish.
Is there a specific reason why you have to avoid the center of the forehead?
I can't remember the reason, but it should be okay with a 3.0. I can't remember the reason for it. But there was one, but I cannot remember it. So see, 25 millimeters, and you can do the same thing this way if you wish. You can make the squares as usual.
How far from the brow? Also,
Yes, so
you stay
can do,
away
yeah.
from the brow.
No, you can do it. You can do up until the brow, no problem. Make sure you don't go directly onto the upper eyelid. Never onto the upper eyelid.
Underneath
never.
the brow.
Underneath the brow, there's no point, and also it could be dangerous to the eye. Because if you remember the way we actually find the shots. Yes, if you remember the way it was we were firing the shots. I mean, it goes inside the skin, so it could actually go into inside the eye. And we're going to do the same here. Same here. Make this usual squares, 25 millimeters, and then the same here, so you can actually treat this whole area here. Here can actually be treated as well. Here you can treat
so
it.
If you
so
treat
up until
here and it tightens,
yes.
it will automatically lift the eye.
That's gonna have some effect.
A little bit of tightening there.
It's gonna have some effect. It's not gonna be dramatic. It's going to have some effect, not dramatic. And then you carry on. So like here. I think I've got to sharpen this pencil.
So you go to the hairline.
Yes.
And I sharpen it for you.
No, I'll sharpen it. What is? Oh, the sharpener
There
is
by
here.
you.
Yeah, I'll do it here. Okay, beautiful. Got it. So like we're there, yeah. And then you can actually make it the other line there if you wish. Another line there. See, it's 25 millimeters, so let's see whether I've got 25 millimeter there. One. Yeah, 25 millimeters round about there. And then here as well.
Just avoiding the cheekbone.
Now in this case, the cheekbone you can actually treat with, because it's a 3.0. But if it's too painful, then you just stop it.
So you go up to the cheekbone.
Yes. In this case with the 3.0. But if it's too painful, just avoid it. Yeah, sorry, I'm just making that line there. So this is with a 3.0, you can actually treat the whole area. You've got to still avoid this area here. Still got to avoid this area. You can treat that. You can treat the whole neck. You can actually really work it.
Underneath the chin.
Yes, as well
and
here.
You can work on top of
Here.
the chin.
Yes, here. You can actually work up until here.
And the chin
Until
itself.
there. No, not the chin. Not the chin. Leave the chin alone. In this case, with a 3.0. Avoid this area here. This area is a no-no. With a 3.0. Even with a 1.5 is a no-no. And with a 1.5, then you repeat the whole lot. And also you do the mouth as well. And the 1.5, I'm just going to say 1.5 is there. I'm going to do that.
I'm just going to take a photo.
Yes.
Now you look like a clown. You're making a clown now.
Yes. And then again, you can do exactly what you've done with a 3.0 and treat the whole face, other than this part here, the central part.
Okay, here I have to turn it.
Did you tell Andreas what Mandy said about us approaching the plastic surgeons?
No, what happened?
Oh, Mandy. You know who Mandy is? The lady from the wound and
Scar Clinic.
Scar Clinic.
Uh-huh.
Now, she said we must approach the plastic surgeons because all the tummy tucks, this upper portion, after a while, they made ridges. Yeah, where the skin has been tightened. And then when they sit, it's just lines. And the only thing that gets rid of that is this high intensity
focus
ultrasound. But the machines that's available is so unaffordable that they don't want to buy that. And one treatment is like 15,000 rand. So she said we must go to them and market this machine so that we treat all the patients, all the cases with this. And even Sherry's sister-in-law, she's got this problem. When I told her this morning, she told me she's got it. So I said, well, send her to us.
Yes.
She can be our first client.
But I said to Mariki as well, girls that have had liposuction on the legs, they get what I call that crepe paper look. And I'm convinced this is the answer.
You're going
to
to
it.
test on my legs because I got it because I lost too much weight in a short time. So
Come sit, Andreas.
Oh, thank you,
I'm
thank you.
like crepe paper now.
Thank you.
Put your bum on the bed.
Thank you.
We'll just adopt you as a kid brother.
Oh, thank you. Everything is going to be in the video, by the way.
That's fine. I'm just fraternizing with the
Just
boss.
I would just have to play around how to maneuver that around her lip to target the whole area.
Go on, Andreas. There you go. There's a spot for
thank
you on the bed.
Oh my god,
Otherwise
yes.
I will take her nose off.
What's that story about cutting your nose to spite your face?
Something
You're just
like-
going to do it.
Okay, let's start at this.
There's one thing about us South Africans, Andreas. We will find ways to use this machine. Don't you worry.
You will set the power and I will push and she will tell me.
Okay.
Okay.
Can you feel it?
It's perfect.
Okay, a little higher.
Can you feel it?
Yep.
She says, okay. You want higher?
Right?
That's fine.
Beautiful. Can you make it higher?
No.
No.
You make it high, I'm going to bite you.
You've got to reach me first. And here we can actually work on everywhere because it's very, very shallow.
Yeah.
Cartridge is very, very shallow.
Oh my gosh!
What happened now?
It's just...
It's disintegrated.
This
You know what?
totally.
No, I tell you what you do. What happened now?
It's just...
It's disintegrated.
This
You know what?
totally.
No, I tell you what you do.
It's just gel everywhere.
Oh, shoot.
Down the cables, blah blah blah. Don't you have a cloth or something that I can wet?
In the corner, there's a funny piece of toweling. I use that to mop up whatever needs to be mopped up. On the basin.
Oh, the big one.
No, the small one. There's a small piece of pink toweling. It's a
Remove this. What do you use to clean? Can you use alcohol?
No.
Or will it take
no,
the
no.
writing off?
Yeah, could actually take the writing off. Just normal water.
And
It doesn't need to be
use it?
sterile
No.
as such. It doesn't need to be sterile.
Just make sure your cartridge is clean before your next client comes in.
Yes, but it doesn't need to be sterile because you're not causing any injuries onto the skin. Onto the skin, you're not going to cause any open wounds.
And what about if somebody, when they come for vaginal tightening, and say for instance you don't know if they've got some other kind of infection, can you work on them if they don't disclose it with you?
Yes, you can. Yes.
As long as you're wearing gloves and you've got a condom on it.
Yes.
So you don't apply gel also on the outside of the condom. You only apply
No,
on the inside.
yes.
But doesn't it, like now, when it becomes hot, won't it also do the same inside there? That the gel becomes hot and then it's more sensitive.
Try and see.
Then you just use KY jelly. It's also clear.
So the way you're
Significant.
working is the same. Just see when it's too painful for them. If it's too painful, you just decrease the power. It's becoming red where you're doing
What
the treatment.
is the, when you've done the tests on this one, what is the general level that you work mostly?
When you've done the test, how do you
Now,
mean?
when you did the testing on this machine and you work on people, when it comes to face and body and all that, what was like when it comes to pain threshold, what was the minimum cut-off power?
As long as I can bear it, I try to always work at the edge. I always try to
you
work.
don't have a specific
No, there's no
level
numbers.
that you found that when you go to that level, that's the time when they can't bear it.
Mariki, just something we must bear in mind is, no, just careful with your pressure.
Oh yeah.
You're wiping hard
Okay.
with paper. It's better to rather go for a bowl of water and the soft sponges. I think it'll be a bit better for the client.
I should have actually took a bowl, but I don't know where she thinks.
My bowl is actually
Okay.
in the car.
Oh, very far from here.
Yeah.
Okay. Now with the markings on the mouth. Where is that?
Okay, now we're going to get the 1.5. 1.5, we're going to change the head to the 1.5. That's it, beautiful. So you can do everything that you've done before,
Yeah, I
and you can
actually
add
like this because it actually gives you an indication where.
Oh yes,
So I looked there and
you can do the same thing, but
Yeah.
now in this case you're actually working a 15
yeah.
here, a 15 mil, and not 25. So the squares are going to be smaller.
Mm.
Yes, because it's
So you go
between
like
here and
the
there. Is,
center of the
yes. So
go center like that.
It's kind of tin more.
Ek moet jou nog, ja, ek moet jou nog iets vertel maar so later. Hoe voel jy?
Yes, right.
Cartridge, doesn't matter which one
it doesn't matter which one. Yes. and usually last. We only had one customer who so far within 6 months managed to use all cartridges. Only one.
Only one.
Only one within 6 months.
I
The rest is
suppose
over
that was
well over
the
a year.
Face, or which one? Okay.
We can actually only target the cheeks, yes, the way they were done before, nothing else. Why? Because we've got a depth of 4.5 inside the skin, as we've seen before, yes. Let's assume we do a 4.5 in this area. We're going to go directly into the bone, yeah?
Yeah.
And that's not, why would you want to treat the bone? Like, it's not possible. The only area which you can actually treat with a 4.5 is this area which is quite thick. Then, therefore, this is why we can only treat the cheek area, the cheeks. This is why. And we shouldn't actually go anywhere else because it's too deep anywhere else, okay? It is too deep. Now, once you've done the 4.5...
treated with a 4.5,
yes.
why would you go over it again with a 1.5?
It's beautiful because you're actually working at different levels.
That's what I asked you earlier.
You're working,
Is
yes,
that
you're
what
working
happens?
different, yes.
The first one targets deep,
Deep,
and then
but
the 1.5 targets shallow.
that's right. And the point is that it's not as if with the 4.5 we can go with a full face, because this area, for example, is too shallow. We can't really go into the bone. So with the 4.5 you can actually only treat this area which is quite thick. The other areas you cannot treat because it's too shallow anyway.
Okay.
Then with a 3.0 you can pretty much cover the full face other than this
Okay,
area
so
and
you-
the mouth and this
Yeah,
area,
so
if you
you-
remember. Oh my god, you're hot. And this area. And then with the 1.5 you can cover the whole face other than this area. So then you basically, the skin gets treated at different levels.
Okay, but now...
So this say for example this area here gets treated at 4.5, 3.0 and 1.5. This area here gets treated at 3.0, 1.5. So this area's got 3 treatments. This area's got 2 treatments. And this area, the mouth, has got only 1. But I mean, see here for example, okay?
Okay, now
So
I
you look at this,
understand.
you look at this and say, I'm going to treat the cheeks, okay? And the way you've done it. Then you're gonna, once you're finished,
Then you go
change
to
that
the
and then go
next
to the
one.
3.5, the 3.0, sorry.
Okay,
3.0, what do you see?
yeah.
You see the area that you can treat, which is
So you
the
start...
forehead, as you've done, all this area, the cheeks again, not the mouth, then the neck, yes, as seen here, you avoid
And the
that area
forehead.
and that area, yes,
Okay.
good. Once you've finished, then you change cheekbones and the mouth. Now you can actually treat the mouth as you've done. Again, the cheek areas, so the cheek areas get treated 3 times at 3 depths, and the neck again. So you're gonna get a beautiful effect.
So I was actually, when I went onto that one, I was actually supposed to start
Doesn't matter.
scratch all over the face.
Doesn't matter. You can actually start from there and then finish off.
But now this area
Mhm.
gets treated once then.
Yes. Because
So
you-
this one 3 times,
3 times,
and this
twice,
and that
twice.
twice.
Yes.
Okay. Okay. Let me
If you want to do it properly,
Yeah, no, I that's what I thought it was certain depths, certain areas, one treatment.
Mhm.
Okay.
only if otherwise you can stop it here. But that's the
But when you go over it again now,
Uh-huh.
like this area
Mhm.
with a 3
Mhm.
and then with a 1, how comfortable will it be by the time you get to the 1.5?
Try. It's the same thing. As I say, you're always adjusting the power level up to the point that she can bear it.
Okay.
How do you feel it?
Sometimes it's like the first one was fine. The second one I could feel. Stings
Is it
a bit
bearable?
more. It's bearable. Ouch, that one is sore. Back down, please, Andreas.
Okay. Okay.
Yeah. Oh, Mariki, I think I need a bit more gel.
Is it?
Hey. The Cuda gel definitely helps. Definitely.
We have to pack it in ice packs.
Yeah, no, it's just...
I think it's because it's also now the second treatment, so it's more sensitive.
Sure. I don't know why I'm feeling it more now.
One
it
on
okay?
top of the other one.
That's a bit more comfortable.
Yeah, because I decreased the power level.
25 now.
Decreased the power level.
But excuse me asking, Mariki, isn't that the spot that went very red earlier?
Yeah, but it's not anymore.
No, but when I'm asking, it's the same area. Okay.
That's how it also.
Ah.
Okay.
Mm-hmm.
Okay. Another round. This way. Is that it?
Mm-hmm.
Cat is not talking anymore.
As long as you put cool gel on, it's fine.
Ah, your neck is all red.
Very. You look toast.
Well, let me tell you something, Andreas. If we can get rid of this chicken neck, I'll be very happy.
Okay, nou moet jy net weer 'n bietjie so.
I must look for that photograph and show you.
Ek voel dit nou. Die tweede
Dis okay.
tweede sessie. Dat ons gaan gel gebruik.
Dis okay. Sure. Jy weet daai kolletjie in jou nek, waar as iemand jou... We've all got that sensitive spot in our neck. When somebody kisses you in your neck and you sort of get those goosies, that was the spot.
So if you want to kiss her there.
Hurry up and get rid of your machine before I clip you. That's the vampire spot.
Eintlik of ek haar nie met jou wil uitstel. As ek al vroeg, ek dink ek moet haar bel, want dit sê weer. Ons is besig met opleiding, ons is nog besig.
En dan moet jy dit nou doen, dan is 12 uur. Waar is jou foon?
En nou in sak.
Hier op.